All right. Good morning, everyone. Welcome to the Medical Society of Virginia and the Virginia Free Clinic webinar, Volunteerism, Virginia's Free Clinics and You. My name is Allie Singer-Wright. I'm the Program Director for the Virginia Mental Health Access Program at the Medical Society of Virginia's Foundation. The Medical Society is excited to offer this webinar about how you can make a significant contribution to the health of the underserved in your hometown. We're thrilled to kick off today with Rebecca Butler. She's the Director of Marketing, Communications, and Development with the Virginia Association of Free and Charitable Clinics. In this role, she also manages strategic initiatives, including efforts to support volunteerism and member-free clinics. A dynamic professional, an adept problem solver, and passionate connector, Rebecca is dedicated to enhancing access to affordable health and working towards a Virginia where all people receive comprehensive quality health care. After Rebecca, we will hear from our presenters, MSV member physicians Dr. Seitz and Dr. McMillan, who are here on with us. Just a reminder, this webinar will be recorded and posted to the MSV website. Additionally, please use the Q&A function at the bottom of your screen for questions throughout. We will answer those at the end. We ask that you keep your questions to the topics addressed today. And if we don't get to your questions or have one on another topic, please email memberservice@msv.org. Now that all the logistics are out of the way, please welcome Rebecca Butler, Dr. Seitz, and Dr. McMillan. I will hand it to you.
All right, well, thank you, Taylor. Really appreciate that introduction. I'm very pleased to be here this morning, presenting to you all. Thanks for joining us bright and early on an 8 a.m. Thursday morning. A little bit about, I know you heard about me, and thank you, Taylor, a little bit about the association. The Virginia Association of Free and Charitable Clinics is actually the nation's oldest free clinic association. In fact, the national emerged out of our state annual meeting and is headquartered here in Alexandria. So we've been around since 1993, and we provide, similar to MSV, essential advocacy support and resources to our members to ensure that the underserved have access to quality health care. In the past year, our safety net clinic partners provided care to over 60,000 vulnerable Virginians and over 209 patient visits with the support of 6,700 volunteers. And never has this collective effort been more important than right now during this challenging and difficult COVID-19 public health crisis. The association is committed to helping our member-free clinics navigate the pandemic to continue to serve as a safeguard for the Commonwealth's most vulnerable. I want to sort of kick things off for those that are not familiar with free clinics, with a view inside some of our clinics and hearing from some of our clinic stakeholders with this quick video.
The people we serve at the free clinics could be your neighbors. They could be your family members. They could be individuals with multiple degrees that fell on hard times because of this pandemic, because of the time, or because of another situation. With this current pandemic, we're experiencing record levels of unemployment and record levels of loss of insurance. We're here to serve the people that may be experiencing this loss, and we're here to serve with open arms, and we welcome them.
Patients that come to free clinics are treated so differently than patients in private practice. The difference is that they're given all the time in the world to be able to talk to the providers, tell the providers what's going on. It allows the providers to really dig into what's happening with that individual in a holistic sense.
I want people to know that just because Virginia expanded Medicaid does not mean that we don't need free clinics, that there is a gap. There's a group of people who don't qualify for Medicaid, can't afford insurance, and need free clinics.
I did have several preconceived notions about what going to a free clinic would be like. I came in here and it blew me away. The professionalism, the grade of the doctors. I mean, I felt like I was at my regular doctor, and the overall just general friendliness and good treatment.
We could not do the work that we do without our volunteers. And that includes the professionals, the doctors, nurses, dentists, but also the lay people who come in and register people and run the front desk and schedule people and that kind of thing.
I give my time to free clinics partly because I'm selfish. That may sound contradictory, but I get tremendous fulfillment from continuing to be a doctor even after my retirement. And to provide health care to people who are desperately in need of health care is even better. They know we're volunteers, we're doing this because we like to do it, not because we have to do it, and I think they appreciate that.
Not only do these clinics offer primary medical care, they offer behavioral health, they offer dental care, they offer medications, often for free, they offer sometimes job counseling, they might offer a food pantry, and patients are not required to pay anything for these services. This is a basic tenet of the free clinics, as the name suggests. Free clinics came about because there are too many people, unfortunately, in this country that are uninsured and cannot afford health care. The free clinics across Virginia are 501c3 nonprofits, and they depend on donations from individuals, without which they could not provide care to the thousands of individuals that don't have insurance in the state.
When I give of my time or my resources to the free clinic, I'm giving to my community. And I am a firm believer in that when we all do better, we all do better. So whenever I can provide assistance and help those that are less fortunate, I know that it's going to cause my community to thrive even more.
All right. So that is a nice introduction to free clinics here in Virginia. They are safety net, not-for-profit healthcare organizations that utilize a volunteer-driven staff model to provide a range of medical, dental, pharmacy, vision, and/or behavioral health services to economically disadvantaged individuals. Here in Virginia, free and charitable clinics have a long history of providing much-needed quality healthcare to Virginia's lowest income uninsured populations, providing that with compassion, dignity, and respect. And with Virginia's expansion of Medicaid in 2019, many of the lowest income individuals in our communities, those that are the traditionally thought of free clinic patient, now have access to health insurance, many for the first time in their lives. Virginia's network of free and charitable clinics are proud partners and advocates for this greater access to healthcare, and work tirelessly with partners to navigate and enroll the newly eligible patients into Medicaid. However, even with Virginia's recent Medicaid expansion, there's still a need for free and charitable clinics for those that do not qualify for Medicaid and cannot afford private health insurance or the direct cost of medical services. In fact, in response to Medicaid expansion, the free clinics in Virginia have raised their income eligibility limits to be able to serve a broader population of the uninsured and underinsured. You might be wondering who that is. Basically, they are now serving an increasing proportion of free clinic patients are a member of the ALICE population, which is a United Way acronym that stands for Asset Limited, Income Constrained, and Employed. These are individuals who do not earn enough to support their own families. They are part of a growing number of households in Virginia that cannot afford the basic necessities, and often when times get tough and budgets get tighter, health insurance may be the first thing to go. In Virginia, 10% of households are living below the federal poverty line, while 29%, almost 3 times that number, are in the ALICE household income range, with income between 200 and 400% FPL, which is basically the expanded income eligibility for many free clinics in Virginia. As you saw in the video, free clinics are a medical home for those in need, delivering important preventative and chronic care to those who would otherwise go without, and helping them to remain healthy, reduce unnecessary visits to the emergency room, and avoid missed time from work due to illness. Indeed, free clinics surround patients with complete care and intervention that they need, enabling volunteer providers such as Dr. Seitz and Dr. McMillan to focus in on what's really going on in a patient's life from a holistic standpoint. Clinics go beyond providing basic medical care in many instances and often address social determinants of health that may be impacting a patient's overall well-being. Free clinics serve as an efficient and high-quality medical home for individuals who either lack or cannot afford health insurance. And this has never been more evident than during this COVID-19 pandemic, which has led to a surge of new patients as unemployment numbers rose and folks lost their insurance through their employer. Free clinics have responded quickly to this unprecedented public health care crisis by implementing telemedicine and other strategies to immediately and safely meet the ongoing healthcare needs of uninsured patients. And here we turn to the medical society members and how you can make a true impact in your local community. As volunteers, especially licensed clinical providers, are an essential component of free and charitable clinic operations. Indeed, free clinics across the state depend on volunteers 14 to 1. There are 14 volunteers for every one paid staff member in free clinic. And many of those are providing those mission-based healthcare services as volunteer physicians, dentists, counselors, pharmacists, etc. And I appreciate your time this morning and your interest. I appreciate the Medical Society hosting this event. I want to turn it over at this point to two Medical Society members and volunteer medical physicians with our largest free clinic in the state, Crossover Healthcare Ministry, headquartered here in Richmond. First to share will be Dr. Donald Seitz, an orthopedic surgeon, followed by Dr. David McMillan, an ophthalmologist, both of which, as I mentioned, donate their time to Crossover Healthcare Ministry and have for years. I really appreciate your time this morning, doctors, and thank you. I'll let you guys pick it up from there.
All right, well, thank you very much, Rebecca and Allie, and thanks so much to the Medical Society of Virginia and to the Free Clinic Association for arranging this seminar. Just a little bit about myself. I finished my residency at MCV in orthopedics in 1974, went into private practice with initially with West End Orthopedic Clinic, which is now known as Ortho Virginia. It's a much larger organization than when I was there. And I retired in the early 2000s. The first few years that I was in retirement, I stayed fairly busy. I was on a couple of boards, the Bond Square Health System Board in Marriottsville, Maryland, and also the St. Gertrude High School Board. So kept fairly busy, but yet I felt that there was more that I wanted to do. I kind of felt like I was getting a big fat F in retirement. And a good friend of mine, Michael Matthews, in 2005 was the chair of the Crossover Healthcare Ministry, chair of their board. And Crossover was opening a second clinic in Henrico County on Keokasan Road, and they were having a dedication in 2005, and he suggested that I come to the dedication and see if I might be interested in volunteering at the clinic. So I came to the dedication. Was very impressed with the Christian heritage of Crossover. That was important to me, and also impressed with the good work that Crossover did. So I've been at the clinic on Keokasan Road every Monday afternoon since 2005. I think what keeps me going to that clinic every Monday afternoon is the tremendous good that I see that the clinic does. As has already been mentioned, Crossover is not a first aid station. I think a lot of people have that impression that we see patients, we kind of patch them up and then move them along. It's not that at all. Crossover provides very comprehensive healthcare to all of its patients. It truly is a multi-specialty clinic, and that's one of the other things that I enjoy about being a crossover is being part of that multi-specialty clinic. We have primary care providers. We have just about every specialty that you can imagine represented by various volunteers, and Dave McMillan and I are part of that. But we have neurology, internal medicine, cardiology, nephrology, you name it, and we've got a community specialist that volunteers to see our patients. And we mental health, behavioral health is a big part of what we do. We truly do look after the body, mind, and spirit of all of our patients. And I would say that we do that a lot better than I remember doing it in private practice. So I'm very, very, very proud of that. What I have also enjoyed about crossover over the years are the various partnerships that have been developed. When I first started volunteering at crossover, if I saw a patient that needed a surgical procedure, a total knee replacement, a total hip replacement, I would have to get on the phone and call people that I knew. And mostly they were members of my former group, and ask them if they would mind seeing an uninsured patient and taking over their care. And that worked well for a while, but then I kept calling the same people all the time, and pretty soon my calls were not being returned as quickly as they were to begin with. So then about 12 years ago, I believe it was, the Richmond Academy of Medicine started a program called Access Now, in which community specialists volunteer to see our patients in their office and then provide for their care, surgery if they need it, in our various community hospitals. And that has been a wonderful partnership, just a wonderful service. And it has allowed the specialists, especially in our community that are still practicing actively, to be involved in this volunteer effort also. So that's been very, very satisfying, I think, for all of us. Crossover is really a hybrid clinic. It's been mentioned just a little while ago that the state of Virginia expanded Medicaid a couple of years ago, and we had our board at Crossover had a big decision to make, whether we would also begin to participate in Medicaid. And we decided that we would change our model a bit and begin to take in Medicaid patients. And the main reason that we did it was because we were afraid that the patients that we were seeing in our clinic that would now become eligible for Medicaid would have difficulty finding primary care physicians in the community to care for them. So we felt that we had a responsibility to participate in Medicaid and continue to care for those patients. So currently we have we care for about 5,000 patients in our clinic, and currently about 1,300 of them are insured by Medicaid. So about 3,700 that are uninsured. And the way our model works is that the Medicaid patients are cared for only by the full-time staff at Crossover, and volunteers see and care for the uninsured patients. And that's worked out very, very well, I think, for everybody. And I think the patients that do have Medicaid are very satisfied with the care that they're continuing to get at Crossover. I think another reason that I continue to enjoy volunteering at Crossover is the friendships, the relationships. I remember when I finished practicing some 15, 17 years ago, I missed greatly not seeing those people that I worked with every day, the people in the operating room, the people in the hospital, the people in my office. Never saw them again. And this same sort of community, the same sort of relationships have developed at Crossover for me. And I would, you know, obviously at some point there's going to come a day when I have to stop volunteering, and that's also going to be very difficult. I think that's going to be about as difficult as it was when I retired from private practice. But I also enjoy the relationships that we have with our partner health systems in Richmond. About 3 or 4 years ago, Crossover developed a program called Bridges to Good Health. And with this program, we partner with the hospitals when they have an uninsured patient who is being discharged. The hospital notifies Crossover, makes an appointment with that patient to be followed in our clinic. And that has been a tremendous benefit to both the patient and to the health system. There's, as we all know, with the uninsured patients and with patients in general, there's a fairly high percentage of patients that are readmitted to the hospital. And with this program, Crossover has reduced the number of readmissions to the hospital down to 3% for these 200 or so patients that we've treated in the last 5 years that were discharged from the hospital. So it's been really a great partnership, and both Crossover, the patient, and the health systems have all benefited from it. So I take my hats off to the team at Crossover for developing this very effective service. The other thing that I would like to emphasize that has helped a great deal is the State Board of Medicine about 12 years ago came out with a restricted volunteer license. And ordinarily, I think it's about $350 for a physician to renew his license every 2 years. With this restricted volunteer license, the CME requirements are the same, but the license only costs around $60 to renew every 2 years. So that's made it a big help for retired physicians, especially to volunteer at free clinics. I will say that I wish they wouldn't have put the word restricted on it, because that tends to be a little confusing. I wish they would have called it just a volunteer license. I remember when I was talking to a CVS pharmacist a number of years ago, and he looked up my license and said, "Well, you've got a restricted license," and he kind of suggested that I was some kind of a criminal. So anyway, I kind of wish that they would have just called it a volunteer license rather than a restricted volunteer license. But anyway, that's been a big help to those of us that are retired and want to continue volunteering. So one of the other, I guess, what I've also enjoyed about Crossover and volunteering at this free clinic is the different reasons, the different motives why physicians volunteer. Some, it's a very spiritual thing, a very religious thing. You know, it's the parable of the Good Samaritan is very important to them. It is to me, as a matter of fact. And for others, that may not enter into it. It may be just that they want to do good. Some look upon it as a civic responsibility to give back to their community. Some of them just want to continue practicing medicine like they did before. These old war horses just want to get back in harness and continue to do what they've been doing for all of their lives and just enjoy the experience. So it's not a one size fits all. I mean, I think all of the clinicians that I know have different reasons for wanting to volunteer at Crossover, and that's also been very refreshing to see. So in summary, it's been a terrific experience for me. I've enjoyed it a great deal. I hope to continue doing it for a long, long time.
Thank you, Dr. Seitz. Appreciate that commentary on your experience and background as a volunteer physician with Crossover. Dr. McMillan, are you able to share your experience?
Well, certainly I'll give it a try. Don is just one of our really fabulous physicians that serves at Crossover. Um, I went to University of Virginia Medical School and then did my residency in ophthalmology out in Detroit at Henry Ford Hospital, and then came back to Richmond to set up my private practice in 1970. And for 22 years, I was in solo practice. And then with all the things that were going on with insurance and with coverage and so forth, the insurance companies were sort of forcing us into doing group practice. And so I founded Richmond Eye and another person, Dr. Jim Ferguson, founded Richmond Eye Associates in 1992. And that has grown from being in solo practice, one doctor, 4 employee situation to a 6 doctor, 45 employee with 3 offices and 3 optical shops. And that's why I have all this gray hair here, I guess. But at any rate, that's been a wonderful experience too. So that was my background as far as that is concerned. When I got ready to retire at age 69 in 2006, I at the time had been back in the 80s president of the Virginia Society of Ophthalmology, which is now called the Virginia Society of Eye Physicians and Surgeons. And so consequently, I was aware that also I was chief of the medical staff at Richmond Eye and Ear Hospital during the times that they were closing the hospital and opening up Stony Point Surgery Center. And so I was part of that, but I knew, having served on the board, that crossover ministry, I knew about them, and I also knew that Dr. Lindy Smith, who was in private practice, was serving on the staff of crossover. And that was before the West End clinic came to be. As it turned out, I was getting ready to retire, and this young ophthalmologist who we were recruiting from MCV to join our group had to wait a year because we had already taken 2 other people. And so consequently, he did a fellowship with Dr. Gar Stevens in cornea. And at the same time, the Richmond Eye and Ear Foundation, now called MDARVA, was supporting the crossover ministry. And so they sent him down there to help out. And so I found out about it through him. So when he took over my patients at practice, I took over his patients at crossover. And so, and so that was in 2006. And then when the new West End clinic came up, I felt that living in the West End, that was the thing for me to try to do. And so I established the crossover, the eye service there. And then finally, just about 2 years ago, all of the eye service is now at the West End clinic instead of at Coordinate. Now, the thing that intrigued me about joining that is, first of all, it was a faith-based health service. And this was important to me. And likewise, I was not a golfer and I didn't have a whole lot of hobbies to do. And so I figured, well, I'll do this. But when I started with crossover down at Coordinate, Lindy Smith was still working and had just worked and just retired this past year when the pandemic hit. But I would go about 4 or 5 days a month, which was just fine for me. And being in a specialty like ophthalmology, there just isn't anybody else in the metropolitan area who provides medical eye care. And so basically I'm it. And so I see patients from Powhatan and from Richmond and from Goochland and so forth. And the staff there is what's so important. I just love working with my staff, and they're so supportive and so appreciative. And also the patients are appreciative. There are very few patients who don't want to thank you in some way for giving them the care. And as you know, crossover, you have to qualify by being 200% below the poverty level, as well as having no health insurance at all. Recently, the Medicaid thing has created a problem for us because the eye care is not covered by Medicaid. And so patients who now have gone from being crossover patients to Medicaid can no longer get eye care at crossover. And so there is a problem with that. I love it because it has not only helped me professionally to contribute, and I don't have to go to Haiti or some foreign country to do mission. We have plenty of mission right here in Richmond. And there are more Latinos or Hispanics in Henrico County than any other place in the metropolitan area. And so you have to be able to have interpreters who speak Spanish. And now we're getting some people from Africa and from the various places over there that are coming here. And we have to have also to be able to speak Arabic. So we have interpreters, and we have a staff which is supported by Madarva because they help us to have an administrative as well as an ophthalmic assistant. I love it because my ophthalmic assistant happens to be Lynn Johnston, was my first scrub nurse when I started in practice in 1970, and now she is helping me out with everything. Our chief thing is here is to provide medical eye care, and without access now to support us as far as doing surgery or referring for retinal problems, particularly diabetic retinopathy, it would just be almost impossible to do. Likewise, we're supported by opticians who give free eyeglasses to our patients. So many times patients come in and they don't have any insurance, they don't have any money. So even if you prescribe glasses for them, they can't go out and buy them. Or if you prescribe medications, they can't afford the medications either. Now, as you know, Crossover does have its pharmacy. We do have drugs there that they're for our patients that can't afford them. Unfortunately, the pharmaceutical companies have cut back on samples. We used to get a lot of samples, and that would help me with antibiotics and so forth. So it is a problem now that the pharmaceuticals have cut back on giving of the doctor's samples. And I used to go over and make a trip to my Richmond Eye Associates and clean out their cupboards and come back to Crossover so I could provide my patients with drops and with medication. I will say that it's been very, very rewarding. I can't tell you how wonderful it is to work with the staff there that's faith-based, and they appreciate, and I appreciate them. You do have to, as a physician, maintain your medical license. And as Don says, that's possible, but it could be expensive. Likewise, you have to keep up your CME. You have to have 30 hours per year of Category 1 CME in order to maintain your license. And I do that by going to Audio Digest, and that's a simple way to do it. It costs about $400 a year, but it's worth it because it keeps me up on all the advances that have been made in ophthalmology, and that's exciting to me. I just can't believe, just since I retired in 2006, the advances in cataract surgery and various other things. And even though I'm not doing surgery, I just really love to see the advances that are being taken, not only surgically, but medically. And I am privileged, and I know Don is too, to have been practicing during a time in which more advances were made in ophthalmology and all the other surgical specialties because of microscopes, because of miniaturization of instruments and with computers. There's been more advances in our time that we worked professionally than there has been in the entire history of mankind. And that requires a lot of keeping up with changing techniques and adopting new things and so forth. So it's been very exciting. And although I'm not doing surgery anymore, I still enjoy seeing what's going on with the specialties. The other thing about serving is that you probably should keep up your malpractice insurance. And it's fairly easy because I'm not doing surgery and I'm not seeing a whole bunch of patients. And so consequently, it costs me about $700 a year to have a malpractice insurance. Yes, Crossover does have an umbrella policy, but it doesn't protect you totally. Now, that's the only other cost, CME plus malpractice insurance. But it's a worthwhile contribution as far as I'm concerned for the privileges that I get from serving in a free healthcare clinic. And as Dr. Seitz has said, I am welcomed by all of the other physicians at Crossover, and I enjoy very much my association with them. And our chief thing that we do there right now is screening for diabetic retinopathy, which is really very important. And I treat glaucoma and I treat other things that I can do medically. But just to have that association with a wonderful staff and to be appreciated by my patients for what I do is certainly very valuable to me. So basically, I'm continuing to work at 83 years old, but there'll come a time, I suppose, when I can't do it. Right now, I'm locked down in Lakewood because of the coronavirus, and I had to cancel my session for this week. But at any rate, I have just felt a great satisfaction in being able to provide mission care without in our own place where it's so needed. And so consequently, I will continue to do that. And I think it's keeping me young, frankly.
Thank you, Dr. McMillan. I appreciate both you and Dr. Seitz' candid storytelling around your experience and fulfillment in being a volunteer in a free clinic. And I'm so glad you touched upon malpractice and coverage, as that I think is certainly an issue that comes up when physicians are thinking about volunteering in a clinic. So thank you for touching on that. And I did want to point out too, that while Dr. McMillan and Dr. Seitz work in Crossover here in Richmond, the association has more than 50 member clinics spread out across the Commonwealth. So, you know, volunteers are needed in the rural communities, in the Tidewater, Northern Virginia, et cetera. At this point, I'd love to open it up for questions that anyone might have, either for me or for the doctors and their experience being a volunteer.
It looks like we had, Rebecca, a first question. A couple questions came through. The first one was, is there assistance? I think I heard Dr. McMillan touch on this just a little bit, but we'd love to hear more. Is there assistance for medications provided at the free clinics so patients are able to fill their prescriptions?
There are ways in which doctors, even in practice, can go to the pharmaceutical companies and get certain medications sent to them free of charge, but you have to jump through a lot of hoops to do that. Our pharmacy at Crossover is always trying to get additional medications, and I have to admit that eye drops and eye medications are somewhat limited, mainly because of the various companies who provide these eye drops. They've been merging and doing this and doing that, and as I said, they don't provide samples at all. And so we have a limited amount of thing. I will mention also that the Virginia, the glasses situation with our vendors who have provided free glasses, that's very important for our patients. One of the most satisfying things that I have is to see a patient who's never even had an eye exam before in their life. and they come in, and even if they got no medical problems, if I can give them a nice pair of glasses to be able to see, that's a real plus. And I can't thank the vendors who, Virginia Eye Institute, opticians particularly, for providing free eyeglasses for my patients. And as far as medications are concerned, various places like Walmart and so forth do have some decreased cost for some of the medications, but that is a real problem because medications can be very expensive.
And the other aspect of that is Crossover has the community pharmacy for all of the free clinics in the Richmond metropolitan area. And we have relationships with various pharmaceutical companies that donate meds to the pharmacy. So we've got a wide variety of the formulary is really quite extensive, and we can get just about anything that the patients need. Some of them are more difficult, as Dave mentioned. Dave pointed out, but the formula really is quite complete, and we serve not only Crossover but all of the other free clinics in the metropolitan area.
There's also a lot of free clinics. I know Rebecca have the medication assistants, caseworkers who there's a program that's been developed that helps them find those pharmaceutical companies that Dr. McMillan mentioned without having to jump through all the hoops and respond to different companies. And so there's actual caseworkers at many of these clinics able to assist patients find the medications in a streamlined way, and that's their only job. So that is a great asset that a lot of the free clinics have. Another question that we had: are there any volunteer opportunities available for medical students?
Go ahead, Dave.
No, that's great. Go ahead.
Well, I was going to say we do have medical students that that shadow at the clinic, and we also have interns and residents that volunteer at the clinic that are part of their rotations. So yeah, there are some opportunities for medical students to volunteer and be a part of their training.
We also have VCU students, or University of Richmond students, who mostly VCU, who want to get an experience, and so they come and be their scribes for us. They do the scribing for the computers, so the doctors don't have to enter things into the computers. It's all done by scribes. Fortunately, the people that we get there also speak Spanish, and that is a big plus because I don't speak Spanish. But at any rate, the staff is just so supportive, and it's just wonderful. We have, I do have some VCU students who are planning to go to medical school, and I think that some of them have, because of their experience with me, decided that maybe they want to go into ophthalmology as well. So it's a wonderful thing to do, to have these students there.
We also had a question come through on the chat box. It was, does VAFCC help clinics coordinate telemedicine volunteers?
Really good question. And certainly Dr. Seitz and Dr. Mcmillan, feel free to weigh in from your experience, but I would say that before March of 2020, telemedicine was not something free clinics employed universally. But of course, with the pandemic, almost 90% of our clinics transitioned to telemedicine resources in order to continue to provide care, especially during those peak months at the onset. Many clinics are continuing to use telemedicine, and we are working to support them. At this point, I would say it's not a comprehensive coordination where we are directing telemed interest towards clinics, but it's something we're working towards. And in fact, right now, something that we were hoping that would be ready today to share with MSV members, but is not, and we're hoping to launch early 2021, is a volunteer opportunity board where clinics can post their strategic licensed volunteer needs. And so we can share that with members, and you can actually see directly what needs are out there and apply to, and directly apply with the clinic. So that's coming hopefully in telemedicine component.
Thanks, Rebecca. And I saw another one that asked, does the VA FCC and or MSV have a volunteer recruiting marketing strategy?
That's a great question. You know, this is the first step down this partnership with MSV. And so hopefully it's something we can build on and, you know, year over year, be able to provide education to MSV members around free clinics and the need to volunteer and give back in your local community. Certainly, we're doing a much larger push for recruitment of volunteers across the state. Generally, as an association, we have launched a Free Clinics Care campaign, which I will actually drop the link in the chat box, which is mainly digital at this point. But we'll also incorporate some radio, TV, and potentially some outdoor billboards starting in January. But again, we are pushing to make it a broader understanding of free clinics, who they serve, how people can support, and certainly get involved to volunteer. Great question.
Yeah.
And so if I were a physician who wanted to start volunteering right away, what would be kind of my first step in figuring out where and how I might do that?
Sure. So if you click on the link that I just dropped into the chat, there is a Find a Clinic feature, and you can search for one in your local community and then directly contact that clinic via the contact button to let them know you're interested in being a volunteer and being a donor. If you're referring a patient potentially, would be your first stop.
Great. Well, thank you so much. I wanted to thank Dr. McMillan and Dr. Seitz as well. And of course you, Rebecca, for bringing all three of you to this webinar today. I did see a question come through about making available the volunteer opportunities. I saw that Rebecca posted the link in the chat. And again, this webinar will be posted on our website with all of this information in it. And so other than that, we will be, of course, posting the recording as I just mentioned. And unless we have any other questions, I might have seen one just pop through that said, is there a list and dates available to look through and decide? I'm wondering if they're asking about times and places they might be able to volunteer. I'm not sure. However, so we can for sure answer that question with a little more clarity. If you want to email memberservice@msv.org, we will help get the answer to what you're looking for. Otherwise, thank you to the three of you, and I hope everyone has a great rest of their day. This concludes the webinar.
Thank you, everybody.
Thank you.
Bye.